Now we are going to discuss peripheral edema, which is the retention of fluid in the leg tissues, which is more prominently seen in those patients who are having the problem with the venous system, lymphatic system, or the kidneys. Here are the techniques for the management of the patient who are having the peripheral edema. First of all, the manual massage. Manual limb drainage massage is a lymphatic massage which helps to get the fluid moving out of the area. By placing a leg wedge pillow under the area provides relief and support the area, and it also encourages the blood flow towards the heart. Here are the different exercises which play a very important role in the management of the patient who are having the peripheral edema. We know that muscle act as a pump for our system. So when we are activating or stimulating our muscle by doing some kind of exercise, we are actually putting more pressure on our limb or into the area, which in turn help to stimulate lymphatic system and then fluid move out of that area. Especially when we notice the edema in the leg, we are generally working against the gravity, so it is easier for the fluid to pull down below. Or when we are pumping our muscle, we are helping to lift that fluid up and out of the leg. When we see any patient who is having the limb edema, we instruct that patient to simply get up and go for a walk or for the swimming rather than sitting all the day and pull more fluid under his or her leg. All of the exercise which we are going to discuss have more beneficial outcome if we place a leg wedge pillow under the leg of the patient. First of all, deep breath or diaphragmatic breathing. All the lymph nodes that we have deep down in our abdomen, the fluid from the leg has to move up to the groin area, and then it has to move up towards these deep abdomen lymph nodes to get out. So by deep breathing, we make sure that we are clearing our deep system. For this, we are instructing the patient to put his or her hand on the belly and gently press down into the belly. Or when you have to breathe out, you can feel that your belly is expanding and you have to resist it with your hand and complete 4 to 5 breaths. Next one is trunk flexion. For this, you are instructing the patient to place or lie on his back or placing a leg wedge pillow under the leg or simply lift his head, shoulder, or neck up and then down and then up and then down. Next one is trunk rolling, which is also called trunk rotation. You are going to instruct the patient to flex his or her knee or fall his or her knee one way, then back, and then the other way, or hold as long as you can. For this, you are going to stimulate or activate the oblique muscles of the patient. Next one is Doodle Squeeze. For this, you are going to instruct the patient to flex his or her knee, or you can simply keep the legs straight by placing a leg wedge pillow, or squeeze both of the glutes together and then relax, and then squeeze them together and then relax. Next one is hip adductor or hip abductors activation. For hip abductors, you are going to instruct to flex the knees and take the knees outside of your thigh and then back up and then the outside of your thigh. For the hip adductors, you are instruct the patient to place a ball or pillow or squeeze together and then relax and then squeeze, and you are simultaneously activating or targeting the hip adductor or hip abductors. Next one is breathing. You are instructing the patient to flex his or her knee or simply lift his back up and then down. And you can also add variation by asking the patient to squeeze both of his glutes together and then lift the back up and then down. Next one is quadricep activation or the leg raise. For this, you are instructing the patient to keep his knee straight down and squeeze the muscle and take the knee toward the ground and then relax and then squeeze and then relax. Or you can also instruct the patient to simply lift his or her leg and hold up there and then slowly take toward the ground and then lift the leg, hold up there and then slowly take toward the ground. Next one is hamstring activation. For this, you are going to instruct the patient to knee up or knee down by sliding your heel. And you can also add variation by asking the patient to lie on the stomach or simply kick his heel up and slowly control by controlling, take it to the ground and then up and then slowly control and take it towards the ground. In the last, the ankle pumps, you can instruct the patient to keep his or her knees straight, which can activate the calf muscles. And you are going to instruct the patient about the ankle pumps. And you are simply instruct the patient to take his toes towards his or her upper body, and then by full stretch, take it toward the ground, and then up, and then towards the ground, and both feet at the same time. All of these exercise, as I have already told you, is more beneficial if we place a leg wedge below under the leg of the patient. You can reverse all of the exercise and repeat them about the 10 times, and then take it toward the beginning of the exercise. Thank you.